this presentation. My name is Sherri Gimson, and I am a DNP student at Maryville University. And this is a presentation on my DNP scholarly project titled Reducing Falls Among Older Adults in Long-Term Care. The following is the project's committee. Chair Advisor, Dr. Gail Petroff. Nursing 707 Professor, Dr. Maria Snell. Second reader, Dr. Rita Wunderlich. And the community member participating at the facility site was Heather Binney. This DNP scholarly project was a quality improvement project designed to incorporate education of evidence-based guidelines to improve fall prevention practices. Every second of every day, an older adult, age 65 years and older, suffers a fall in the United States, and those falls are the leading cause of serious injuries and injury-related deaths among older adults, that age group. In the year 2021, the CDC reported that 38,742 older adults aged 65 and older died from preventable falls. Through evidence-based research, I found that a common barrier to fall prevention among older adults was a gap in nursing knowledge. The goal of this project was to reduce fall rates through an increased knowledge for long-term care nursing staff on the guidelines provided by the Stopping Elderly Accidents, Deaths, and Injuries Initiative, otherwise known as STEADY. This is part of a comprehensive list of fall recommendations from the CDC. The project's guiding research question was, for older adults aged 65 years and older, residing in a long-term care facility, will educating nursing staff on evidence-based fall prevention guidelines reduce the rate of falls? The background on the importance of fall prevention. Falls among older adults are preventable and should not be considered an inevitable part of aging. 1 out of 4 adults will fall each year in the United States. According to the Centers for Medicare and Medicaid Services data, in July 2022, approximately 1.2 million older adults aged 65 years and older resided in long-term care facilities. And over 20% of these falls in long-term care facilities ended up with serious injury. And the significance of importance are the results of serious injury falls. They negatively impact the older adult's quality of life by resulting in pain, decreased mobility, depression, isolation, and a fear of falling again. The traumatic results of a serious fall also contribute to high healthcare costs. According to the Centers for Disease Control and Prevention in 2021, the cost estimate of falls and injuries related to falls among older adults amounted to $35 billion annually. Approximately 1/3 of that cost resulted from falls among older adults living in long-term care facilities. The number of older adults residing in long-term care facilities is predicted to double over the next 20 years. This prediction is associated with the realization that injuries related to falls will also increase. Nurses are given the responsibility of utilizing best practice guidelines in order to provide safe, individualized, patient-centered care in order to produce quality care outcomes. Falls among the older adult population has long been a significant concern in the community living facilities throughout the United States. The Director of Healthcare Services at the project's chosen site identified a gap in nursing knowledge for effective and individualized fall assessments and interventions and screening. The literature search strategy for this project focused on evidence-based information found in peer-reviewed articles and studies focused on falls among elderly population using multiple databases, such as CINAHL, PubMed, Medline, and the Maryville University Library. As current research has shown, the devastating outcomes of elderly falls in long-term care continue to be a significant concern. Current research has also shown a lack of knowledge of best practices that support fall prevention among the nursing staff. Elderly adults have physiological risk factors that increase the probability of a fall. including muscle weakness, gait disturbances, cognitive changes, vision changes, chronic diseases, and medications, although these risks are either modifiable or controlled. Effective fall prevention programs need to be evaluated for effectiveness in order to identify issues and barriers that prevent desired outcomes. This includes adding evidence-based strategies by staff education through a solid framework that will promote turning nursing knowledge into action. The theoretical framework for this project followed Lewin's change theory model. Lewin's three-stage plan has changes that require unfreezing, which is develop and identify your change, moving, initiating this change, and then refreezing, establishing the change. Pardon me. The study initiative is what was followed for the educational portion of this intervention on the project, stopping elderly accidents, deaths, and injuries. This is a CDC initiative to prevent falls among older adults. It has evidence-based fall prevention tools with screening, assessment, and intervention algorithm, resources, and education for both healthcare providers, patients, and caregivers. This is easily found on the cdc.gov/STEADI, STEADI website. The information in this initiative has used evidence-based guidelines for best practices, and these guidelines were developed by both the American and British geriatrics societies. STEADI training was aimed at decreasing the gap in nursing knowledge, and by using the tool of the STEADI algorithm, which focuses on individualized screening criteria, assessments, and individualized interventions for fall prevention. The training for this project was delivered to the nursing cast in a one-to-one format using both verbal and visual aids. Both routine and agency nursing staff on multiple shifts were identified as being educated on the STEADI initiative, and this was done over a 2-week period. Methods and design. This project was a retrospective review aimed at a quality improvement initiative supported by a collection and analysis of both quantitative and qualitative data. Quantitative data included the project site's fall rates in a pre- and post-test design over a 6-month period. The qualitative data included observational field notes, which recorded the environment, the level of nursing staff as routine, as far as routine versus agency, as well as the opinions of the nursing staff on what they see as the areas that need to be improved for effective fall prevention. The qualitative data included those interviews, and the PDSA framework was used for this project. The PDSA method is a systematic, problem-solving approach that will support the success and improvement of this project. All data was reviewed and interpreted to support the strengths and limitations of the outcomes of this scholarly project. Quantitative data collected for pre- and post-fall rates was compared to provide a percentage rate. This project goal was to show a reduction in fall rates by at least 10% as a quality improvement. The project itself was conducted over a 6-month pre- and post-design. This included a look at 3 months pre-project interventions and a look at 3 months post-project interventions by the nursing staff. The project focused on the education and implementation of evidence-based guidelines aimed at reducing fall rates among an elderly population in a long-term care facility. A qualitative exploratory design was utilized, again, as a plan, do, study, act design. Participants were not engaged. Only a retrospective chart review was utilized for this project along with the qualitative nursing responses. With information obtained from the facility site's electronic database and researchers' field notes, this researcher recorded the minimum necessary data through inclusion and exclusion criteria. The implementation timeline for nursing staff was estimated to be 2 weeks. Post-design data collection again continued 3 weeks after the project implementation. Analysis and final report were estimated to take 2 to 4 weeks. Identified gaps in nursing knowledge were addressed utilizing the Center for Disease Control and Prevention's study initiative. Recommendations for program improvement were based upon the practice of the study guidelines. The nursing staff at the chosen long-term care facility site identified a barrier in effective fall prevention. The project focused on the education and implementation of evidence-based guidelines aimed at reducing falls in elderly population among the long-term care facility residents. Again, this project focused on educating nursing staff that were both routine and agency on the day, evening, and night shifts in the education of evidence-based fall prevention tools and interventions and how to use the study algorithm for screenings, assessments, and individualized interventions. For this study, the lower tail z-test for the difference of two proportions was utilized through the SPSS software system and with the help of Maryville University statistician Dr. Paul. The short time frame of this project, along with staff shortages and an increased use of agency, may have contributed to some of the outcomes of this project. All of this was affected still post COVID-19 pandemic staffing. There was no missing data. Data collection was maximized when the study protocol was designed and data collected. A total of 150 resident records were extracted from the EMR. All of these residents were 65 or older and were identified fall risk. This study used descriptive statistics to analyze the quantitative fall rate data in a pre-post test design again. The inclusion criteria included 150 long-term care residents 65 years and older, again identified as a fall risk. The analysis of data collected for this project showed a 0.4% decrease in post-project fall rates. This did not meet the desired goal of a 10% decrease. Data analysis did not show a statistically significant difference alone between the pre- and post-fall intervention rates. A quality improvement project aimed at increasing nursing staff knowledge of the CDC's study initiative-based guidelines, again, was used for the training purposes. In this figure 2, you can see pre- and post-intervention fall rates. And again, these numbers that were implemented into the lower tail z-test were the number of falls. Pre was 45, post 40. The number of occupied beds and the number of days remained the same. Again, there was only a 0.4% decrease from pre to post fall rates. That's what this figure 3 is showing. Results here on figure 4 are showing you some of the data collected on pre and post interventions that were taught by using the evidence-based guidelines to the nursing staff. And this reflects on how many of these specified screening areas recommended by the CDC were used pre-education intervention and post-education intervention. Although this project did not meet the 10% decrease in statistical significance, it did show some positive results on these screening interventions from pre to post. As you can see, in the pre-intervention, gait, strength, and balance were lower than the post-intervention, meaning that the nurses used the screening process of assessing the resident's gait strength and balance more in the post-educational intervention than they had in the pre. Other significant figures are footwear screening went up 8% post-intervention. Comorbidities was the largest increase from 27% pre to 43% post. Surprisingly, a decrease in medication screening decreased from pre to post. Limitations. No bias was identified in the scholarly project's design, measurement, or data analysis. Limitations and barriers were identified during the process of the project, such as an increased nursing staff workloads, again, still some ramifications from the recent COVID pandemic 19 influences, decreased staff availability to educate. Initially, this was going to be a 30-minute PowerPoint lunch and learn due to the decreased number of routine staffing and increased in the workloads. This was not a desirable format. This was changed to a one-to-one nursing education opportunity where I took several nurses, both routine and agency, over a 2-week period on multiple shifts to train and educate on tools and resources and effective guidelines recommended by the CDC study initiative. A need for a larger sample and a longer time frame would be desirable for this research project. In order to do this effectively, healthcare systems must remove barriers. To do this, meaning fall prevention among older adults. They must increase awareness and knowledge, incorporate initiatives focusing on individualized fall interventions, and identify gaps in current fall prevention knowledge. Although the statistical data did not reflect the desired outcome again, there is plenty of research that shows a well-educated nursing staff on evidence-based guidelines will have improved outcomes using the CDC's STEADY initiative. Conclusion. Some of the most common factors related to older adult falls in long-term care facilities are inadequate assessments, protocol adherence, and nursing staff education. The project looked at and addressed each one of these areas by utilizing the CDC STEADY initiative. Evidence-based guidelines along with the supported tools and resources were used as the educational design for this project. Implications for further research are supported by the existing body of evidence discovered through an extensive literature review. Evidence that shows greater success in fall prevention among older adults relies heavily on educating and supporting nursing staff and the needs to provide the practice. For older adults, 65 and older falls continue to be the leading cause of injury in the United States, with the number of older adults residing in long-term care facilities predicting to double over the next 20 years. Nursing care for these residents must have a sound knowledge of evidence-based fall prevention guidelines. It is important to first identify the gaps in fall prevention programs and then add education and support and resources to the nursing staff for fall prevention screening, assessments, and individualized interventions that are relatable to that environment. With more excellent knowledge of what it takes to make a fall prevention program, advanced practice nurses can promote evidence-based research that improves the identification and prevention of falls among this older adult population. Again, significantly decreasing fall occurrences related to modifiable or controllable risk factors that were identified. Through a structured program evaluation, the goal is to identify these gaps in the current fall prevention programs. Older adults in long-term care can still lead meaningful and healthy lives if healthcare providers are dedicated to ethical and moral responsibilities, continue to ask and seek knowledge on the latest evidence-based processes that lead to a reduction in fall occurrences, and find the most effective ways to implement these process changes, and to learn to monitor and evaluate. It is the responsibility of healthcare providers to implement and evaluate this evidence-based initiative that will assist in keeping a vulnerable population safe. There is an external source of ethical knowledge related to moral value expectations in our nursing profession. There is also an internal component each of us must recognize that we have formed on our own set of ethical values. If I were to do this research project over again with a longer time frame and better access to routine nursing staff, I believe that a 10% reduction or greater could be reasonably obtained and supported. Knowledge regarding current evidence-based practice related to fall prevention will enable nursing staff to provide enhanced and safe quality care. In my future practice, I will continue to stay up to date on the most recent evidence-based guidelines and continue my passion to see older adults live the best quality of life for as long as they have. Please let me know if you have any questions. I thank you for your time. Please see the next and last slide for any references. Thank you.